Lyme disease, also known as Lyme borreliosis, is a vector-borne disease caused by the Borrelia bacterium, which is spread by ticks in the genus Ixodes. It is commonly known as deer tick. Borrelia burgdorferi and Borrelia mayonii cause Lyme disease in the United States. On the other hand, Borrelia phthalii and Borrelia guerinii are the leading causes in Europe and Asia. Symptoms. The signs and symptoms of Lyme disease vary from patient to patient. Early signs and symptoms may include rash. From 3 to 30 days after an infected tick bite, an expanding red area might appear that sometimes clears in the center, forming a bullseye pattern. The rash, also called as erythema migrans, expands slowly over days and can spread to 12 inches across. It's typically not itchy or painful but might feel warm to the touch. Erythema migrans is one of the hallmarks of Lyme disease, although not everyone with Lyme disease develops the rash. Some people develop this rash at more than one place on their bodies. Other symptoms: fever, chills, fatigue, body aches, headache, neck stiffness and swollen lymph nodes can accompany the rash. If Lyme disease is left untreated, the symptoms may get worse and more symptoms may appear, such as erythema migrans may appear on other areas of your body. Joint pain. Bouts of severe joint pain and swelling are especially likely to affect your knees, but the pain can shift from one joint to another. Neurological problems such as weeks, months or even years after infection. You might develop inflammation of the membranes surrounding your brain, meningitis, temporary paralysis of one side of your face, Bell's palsy, numbness or weakness in your limbs, and impaired muscle movement. Causes. Lyme disease is caused by the bacteria Borrelia burgdorferi and Borrelia mayonii, carried primarily by black-legged or deer ticks. To contract Lyme disease, an infected deer tick must bite you. The bacteria enters the skin via bite and eventually make their way into bloodstream. In most cases, to transmit Lyme disease, a deer tick must be attached for 36 to 48 hours. If you find an attached tick that looks swollen, it may have fed long enough to transmit bacteria. Removing the tick as soon as possible might prevent infection. Diagnosis. Lab tests to identify antibodies to the bacteria can help confirm or rule out the diagnosis. These tests are most reliable a few weeks after an infection, after body has had time to develop antibodies. They include Enzyme-linked immunosorbent assay, ELISA, test. The test is used most often to detect Lyme disease. ELISA detects antibodies to Borrelia burgdorferi. But because it can sometimes provide false positive results, it's not used as the sole basis for diagnosis. This test might not be positive during the early stage of Lyme disease. But the rash is distinctive enough to make the diagnosis without further testing in people who live in areas infested with ticks that transmit Lyme disease. Western blot test. If the ELISA test is positive, this test is usually done to confirm the diagnosis. In this two-step approach, the Western blot detects antibodies to several proteins of B. burgdorferi. Treatment. Antibiotics are used to treat Lyme disease, such as oral antibiotics. These usually include doxycycline for adults and children older than 8, while amoxicillin or cefuroxime for adults, younger children, and pregnant or breastfeeding women. Intravenous antibiotics. If the disease involves the central nervous system, doctor might recommend treatment with an intravenous antibiotic for 14 to 28 days. This is effective in eliminating infection, although it may take you some time to recover from your symptoms. Thanks for watching the video. Do comment if you have any questions. Also, don't forget to give thumbs up if you liked the video.